We're going to be talking about treatment planning for implants and really evaluating an edentulous space. So I want to start with a story. And Robert is a patient of mine, and I think this probably happens to lots of us. I bumped into Robert in the hallway. He says, "Hey, I'm missing a tooth. I want an implant." Is he really asking for an implant? I don't think so. I think what Robert's asking for is a tooth. He knows he's missing a tooth. He knows he wants something in there. He's maybe heard of implants, and he knows he wants to do something. And so by him asking me for an implant, he's really asking for treatment options. And for us at Spear Education, we follow Dr. Spear's recommendations with facially generated treatment planning. And our treatment planning is really systematic. You can find that in other areas on our digital curriculum. But the short version is we want to look at all the areas. We want to look at the aesthetics first. And so aesthetics, I'm thinking tooth position, tooth arrangement, the gingival levels, tooth contour, tooth color, those kinds of things. Next, we want to understand and appreciate the function. And so we need to evaluate things like the jaw joints, the patient's guidance, how the muscles are doing, how the patient is functioning. After that comes structure. And when we're thinking about structure, really we're identifying teeth that need to be restored and then figuring out what we're going to use to restore those teeth. And that's really stuff that we learned pretty well in dental school. Biology comes last, kind of backwards from the way lots of us learned how to do this in dental school. And biology, well, that's stuff like oral surgery, endo, perio, and in the case of implants, lots of times it's going to be our augmentation procedures. So let's see how this works for Robert.